Okay, thank you.
That's okay.
Yeah.
Before we delve into CarePlanner and I start showing you around, do you have any initial questions that you might like to start with? Or are there any particular features that you might like to see on the session today?
Yeah, it's mostly clocking in and clocking out as well. And also things like the care plans and stuff. But I think I will see what this does, and then after, I think I'll have a few questions.
No worries at all. The one thing I will say in regards to care plans is with our system, you won't have any space to like create them within the system or to use templates. It would be a case that you create your care plan outside of the CarePlanner system, and then you'd upload it against your client profiles. And then with those, you can still share them with the carers, and that can be done via our CarePlanner mobile app. They'll have a read-only copy of it there, which they can only view through the app.
Okay.
All right. And I'll be able to show you around a little bit of the mobile app and the rostering in terms of how we create the appointments to get them across there, as well as some of the clocking in and out information and all of the rest of CarePlanner as well.
Okay.
All right. And as I'm talking you through today, if you've got any questions whatsoever, feel free to jump in, talk over me if you need to, and I'll do my best to get your questions answered off as we go.
Okay, I will do.
Super. All right. Well, I will start with just a couple of the basics. So with CarePlanner, the system itself is cloud-based, so you can access it anywhere in the world on any device. And the way you access it is via this unique URL.
Yeah.
And right at the start, mine says EC demo, but you usually have your company name in there instead, or an abbreviation of it. And in terms of security, it's backed on HTTPS, which is the same level of security as the online banks and retailers use. And we're hosted on Amazon Web Servers. So nice and safe and secure. And in terms of your other administrators and office staff that might need access to the system, you'll be able to create them their own login details. And you can then set different roles and permissions, which will limit their access. So you might have someone that helps you with rostering, but you don't want them to see the finance elements of CarePlanner. In that case, you'd be able to limit their account and just completely hide the finance area from them.
Okay.
And in terms of CarePlanner as a company as well, just to give you a bit of background there, we've been providing the CarePlanner system now for just over 10 years, and it's currently being used by just over 2,000 different care agencies. Most of those will be based in and around the UK and Ireland, and most of them will provide some form of care out within the community, so maybe home care, supported living, and sometimes things like live-in care as well. But it is also used in a couple of other sectors too. We've got companies that will use it for like pet sitting companies. I think we've still got a minibus company that uses CarePlanner as well. It's quite versatile in the way that it works. There's lots of elements that you can customize and sort of add in your own business language too. But I can show you how we do that as we go through the demo today.
Okay.
All right. I mean, do you have any questions on anything so far?
No, so far.
Right.
Yeah.
Well, let's get logged in. The very first screen we see when we log in as an administrator is this dashboard.
Yeah.
Now, this is all about bringing our attention to things that might need us to take some action. And on my dashboard, I'm looking at my unassigned appointments over the next 7 days. And that's got the client's name, the dates and times of the appointments, a little hyperlink to take me across to start editing the roster, and the button on the end, which allows me to get CarePlanner to recommend a carer if I don't know who to send.
Okay.
As well as these unassigned appointments, I'm also looking at the expired or expiring checklist and training items. So CarePlanner will first of all give you a notice when these items are coming up to expiry within the next month. But in my case, I've either never input them in the first place or I've not kept them up to date. So CarePlanner is having to alert me that they're already expired.
Yeah.
And the actual business language that sits in those two areas is named and created by yourself. Mine are just examples. And when we create them, we tell CarePlanner how often they repeat or whether they might be an item that we just complete as a one-off. And you can choose to store documents against these as well on a client or carer basis.
Oh, okay.
And then the last two little bits on my dashboard are weekly stats and upcoming birthdays, but it doesn't have to look identical to this. We can pick these blocks up and drag and drop them around to change the layout. And we can also close them down if we no longer want to see them. And if we go back to the top, in the left-hand corner, you've got the green button, which says Configure Dashboard. And this will give you some additional information blocks that you could share on your dashboard.
Yeah.
And changing it for you doesn't change it for any of your other administrators.
Oh, okay.
And then to navigate around CarePlanner, we can start to use these hyperlinks, or we can use the toolbar along the top of the screen.
Yeah.
And the bit I'm going to take you across to next is admin. So right on the end.
Yeah.
And we're not going to spend too long in here because it's essentially a settings page for your CarePlanner system. And it's where we can start to edit the business language, as well as how some of the features are working. And even in some cases, how CarePlanner makes certain decisions.
Yeah.
So one of the bits I'll look at with you is going to be care required. When I click into this list, it shows all of the different tasks that I've created. And when it comes to creating my appointments, I can link those tasks onto them. And that's able then to show on the app. And when the carers are clocking in and out, they can submit which tasks have been successfully completed.
Oh, okay.
So all of these are examples that I've created. And to set them up yourself, you press the green button at the top. You pop in the care type title. And when you press save, it creates it on your system.
Yeah.
And as well as being able to link them to the appointments, you can also see them on the carer profiles, and you can use it as a list to say what skills that each of the carers have. So then if you've got carers trained to different levels and you try to allocate someone that isn't suitable for an appointment because they don't have the right skills, CarePlanner will give you the alert and tell you that there's a problem.
Oh,
and I should be able to show you some examples of that as well when we get across to the rostering screen.
oh.
So that's all I'll go into for now in the admin area. We might jump back in here as we go through the demo today. If you've got questions around any of the settings, but just know that with CarePlanner, you'll have complimentary training with us, which would be conducted with a dedicated account manager. And part of that training will focus on filling out some of the sections under admin. And then ongoing, you have access to our support team. So if you're ever stuck or struggling with anything at all, you can click on that Get Support tab, and it's going to take you over to our support portal. And it's got lots of help articles and user guides, FAQs, as well as all of the contact details for the team as well.
Okay.
Any questions so far?
No, not yet.
Amazing. Well, what we'll do next, we'll start to look at something a little bit more interesting. We'll go over to the carer and the client profiles.
Okay.
We'll do a quick run through of carers, first of all.
Yeah.
When I click into my carers tab, I've got the option in the top left to create somebody new. And then I've got a list of all my existing carers on the left-hand side.
Okay.
If we look at creating someone from scratch, what this will prompt for is a status to say whether this carer is already actively employed or whether they might be a candidate at this stage. And you can kind of track their progress on the system.
Okay.
You've got space for their name, date of birth, contact details, and their address. And right at the bottom, I have these different areas and branches that I've created. So I have to select which areas this carer can work in, and then pinpoint their home address on the map.
Okay.
And then we can save the profile.
So
I'm
those
not going to create.
places.
Sorry. You carry on.
Those places that you can choose where the carer can work, you can create as many as you want.
Yeah, you can indeed. And that is back over in admin. So if we went back to this settings screen, over on the left, the second one down is called regions. So these are the 4 that we just saw on my system. But if I needed more, say I was opening another branch or another service, I can press this green button. I can pop in the name. And if it's got a different logo, I can upload it here. You can pop in the address, the contact details, and you can use custom invoice numbering for that region. And once we create it, In the very top right-hand corner, there's a drop-down menu. And this is showing me all of my different areas and branches.
Yeah.
I can choose whether I'm looking at all of them at the same time, or whether I might want to refine it down and then only look at the profiles and the appointments relevant to those areas.
Oh, okay.
You can also set up other administrators with region-only access. So if I had a user that was only going to work in, say, my Bridgewater area, I could set it up so this is all they could see. They wouldn't then see any of those other areas or branches on their system.
Okay. So I can also say, I want to find someone who works in Leeds, for example. I can just go and search Leeds branch, and then I can see a drop-down list of everyone who is available to work in Leeds, something like that.
Yeah, absolutely. If we go across to the carers tab here, you can see the list of carers is quite long at the moment. But if I refine it down to my Bridgewater branch, you can see that really condenses, and I've only got the carers that work in that area.
All right, okay. Yeah.
Any other questions so far?
No, that's it.
Cool. All right. We'll jump into an existing carer profile. So I've opened one in the background here. Clicked into dashboard at the top, which is where we'd find those personal details and the address again. And also gives you space for people like next of kins or emergency contacts if you want to store those against the carer profile. And a couple of other nice bits under the dashboard tab are the client and carer preferences. So with these, we can say, does this carer prefer or disfavor going to visit certain clients? Or maybe working with certain carers on double up appointments.
Okay.
Everybody starts in neutral to begin with, and then it's just one mouse click on the green plus or the red X to get them into the right place. And if I allocate Brian onto an appointment with his disfavored client, then again, the system's going to give me an alert and let me know that there's a problem.
All right.
And it'll do the same when we look at carers availability. If we've set where the carer is usually not available to work, or if we set the maximum hours or maximum evenings and we exceed those, CarePlanner can give us alerts when we exceed these and when we allocate if they're not available.
Okay.
And this pattern of availability that I've created for the carer here will show on my rostering screens in amongst the appointments, so I can visually see where I've got carers available to pick appointments up.
Yeah.
And the pattern of availability, if you need it on an alternating week pattern, that can be created over in the top right-hand corner, choosing it from the drop-down menu.
Oh.
And there's also space to track the carer's time off. It's a little bit further down on the left. If we click into time off, we can add this in, choosing the type from the drop-down menu and setting the dates and times that that's going to apply to. And when we save it, if that carer is already assigned to appointments, CarePlanner straight away gives me that alert. It tells me that I need to reassign all of the appointments here. So for the Tuesday, we've got a few listed. You've got the client's name and you've got the tools to be able to reallocate. I could ask CarePlanner to recommend a replacement for each visit using the hyperlink. And then that's going to try to calculate who's best, show me the most suitable at the top of the screen with the mode of transport, their availability. And if we click into the purple appointment here, that's the one we're trying to allocate them to. And it'll break down the reasons as to why they've been chosen.
Yeah.
And in this case, the carer's continuity of care is displaying at the top. You've got the availability, any overlaps between other appointments, if there were any. You've got carer client preferences, skill sets, distance and travel time, and the hours requested or contracted by the carer in comparison with the hours they're already assigned to.
Yeah.
So if I wanted to assign them, I press select on the left. For now, I'm not going to reassign this, but if I close it down and go back to this screen, there's a couple of other methods I could use to reassign appointments as well. I can press the Save and Assign To button and leave this drop-down menu set to nobody. That's going to make them all unassigned and I can deal with them later.
Yeah.
Or if we click into the drop-down menu, it lists all of the carers and I could choose one individual that's available to pick up all of the visits underneath.
Oh, okay.
And I won't save it at all for now, close it down. But do you have any questions so far?
No, not yet. No, also, when you add the carers, do you add also, can you also upload their trainings, their certificates, their and stuff like that?
You can indeed, yeah. There are checklist and training tabs slightly further down on the left here.
Okay.
Checklist is things like car insurance, DBS checks, spot check supervisions, but these are just my examples. So anything that you would need to complete or collect when onboarding your staff and as they're working for you, you can create it as a checklist item. You set how often it needs to be refreshed or if it's a one-off. And then when we update these, you just tick the boxes on the left, you'd update the date taken, and CarePlanner will prompt you to upload the document if you've said it's required.
Oh, okay.
And then you've got a similar section for training. Again, this is just a list of training types that I've created. And when I have the certificates or proof of attendance, I can upload the documents against it from my computer. And to be able to update the dates for these training, I press the schedule training button. So this is slightly different this time. What we're doing is creating almost like a training appointment within our rostering. So when we tell CarePlanner the date and time that the training is taking place, it will show on the carer's roster, so they know they've been booked in for training.
Okay.
It'll also work in the same way as time off, in the fact that when we save it, if it clashes with other appointments, the system will give you that prompt and get you to reallocate them, so we're not double booking the carer.
Okay.
And then one other really nice bit on the training is the attendees section. If I was to click into the drop-down menu here, next to the carer's names, it will actually show me on this screen whether the carer's never taken that training before or when the refresh date would be due by.
Okay.
Tag those other individuals in. I'll close this down and then we'll jump across to the client profiles. So the layout for clients is very similar. If we look at creating somebody new, we press that green button, we fill out their basic details into this form, choose the areas or branch they belong to, and pinpoint their address on the map. And then I've got my example client of Abby here.
Yeah.
If we go into this dashboard tab at the top, the CarePlanner has space again for the personal details, for the address. Address for clients also gives you space for entry notes and key safe numbers. We've got space for important contacts again, maybe people like next of kin or key holders.
Yeah.
And if you wanted to, you can choose to share certain contact types with the carers on the app.
Okay.
And if the client had preferences over the carers that were coming to visit them, you can populate their preferences as well.
Oh, okay.
And the profile is where we start to create the appointments. And there's two different ways that we can create appointments. We can either do that from the schedule or the roster. And the difference between the two is the schedule is your master template. So if your client has a repeating pattern of appointments, this is where you'd create it. And that's exactly what I've done for Abby.
Yeah.
Having 3 appointments a day, every day of the week, some of which I'm trying to send a regular carer to. So for example, with this Monday morning appointment, this carer would be attending every single time. Whereas the ones in orange, I've left those unassigned because I don't know who's going to be available every single time. And I'll deal with them as and when I know who's suitable.
Okay.
And just like we saw on the carer's availability, if I need the client's schedule to be on an alternating week pattern, I can choose that from the drop-down menu in the top right-hand corner.
Yeah.
And the way we create the appointments is by pressing on the green button in the top left and filling out the form that appears within this pop-up box. I can say, do the appointments start from today, or is it a date in the future? And what times do I want to create this appointment for? And what days of the week do I want to apply it to? We can also then set if you need to make the appointment time critical by limiting how much the start times can be moved by. You can choose that limit from the drop-down menu. And underneath, CarePlanner is asking whether we know an expiry date for these appointments. Do we know when they're going to come to an end?
Yeah.
If we do, we can tick the box and input that straight away. But if we don't, we can leave it unticked, and CarePlanner will just continue to create those appointments, essentially until the end of time. You can jump as far ahead then in your rostering as you need to, and all of these scheduled appointments will be there ready to go.
Okay.
And then over on the right, if you did want to start allocating those regular carers, you can allocate them using the drop-down menu or by asking CarePlanner to recommend, or we can just leave the carer set to required if we didn't know who was going to go every time.
Yeah.
And you've got the same options when it comes to perhaps allocating a second carer, a shadow carer, or a third carer onto the appointments. And if you started working in runs, or if you work in runs now, you can set up your own run names and you can group the appointments in that way within the schedule. And I can show you how those look on the daily rostering screen as well. So just like this, we could press save and create these appointments. However, before we do, we might want to link some tasks or additional notes for the carers. We can use these two tabs along the top. Care required is that bespoke list of tasks that we would have created, and it is just a case of ticking the boxes to link what needs to happen. And if we went across to notes, this gives you a free type text box. You can type directly into that one, or you can copy and paste information from elsewhere. And when we were happy with that, we would press save. It would create this bundle of appointments. And depending on the type of schedule you were creating, you might run through that process a couple of times.
Yeah.
And as soon as we create appointments in the schedule, we will then automatically find them in the roster.
Oh, okay.
But the roster is your date-specific appointments. So straight away, when I click into roster, I'm looking at this week. I've got today highlighted in pink, and I can see that the schedule's copied over. And for the most part, it does look the same. There's an additional appointment here, which has since been cancelled, and I can see it's cancelled from the different color of the appointment.
Yeah.
I've got a few appointments for today, which are unassigned. They're showing in orange. And if I wanted to start making changes to any of the visits for this week, I can use drag and drop features if it's a change to the duration or the times of the visit.
Yeah.
And I can also click onto the appointment itself to bring up a pop-up box and make changes from within here. Really similar to what we saw when creating them. And I don't just have to look at this week. If we grab the calendar tool, I can jump as far ahead as I'd like. I'm going to go for the week commencing Monday, the 14th of August. And again, you can see all the scheduled appointments are already in here ready to go. I can see one of these appointments looks a little different. If I click into this and go across to history, CarePlanner will actually show me the audit trail of all of the changes that have been made. I can see when the appointment was initially created from the schedule and every change that's been made since, who it was made by, and the date and timestamp of that change.
Okay.
Did you have any questions so far?
No, not yet. So the care plans, so that's where you have to upload like a PDF document, isn't it?
Exactly that, yeah. So under care plans, we can set how often the review is required.
Yeah.
We can then upload our own document, inputting a description, who it's reviewed by, and when the review date was. And when we press save, it builds up almost like a report underneath. You've got the assessed date, who it's assessed by, when the review is due, the description we've uploaded, and the document. We can then email these from the CarePlanner system, but you can also choose in the background settings to have those displaying on the carer's mobile app.
Oh, okay. Or you can email it to the carers directly, to their emails.
Yeah. Or you can email it out.
Oh, okay.
And you've got checklist items under client profiles as well. So things like risk assessments, fire alarm tests, medication reviews, and anything else you might want to keep on top of. We can create that as a checklist item. And again, we can tick the box to update the date taken and choose to store documents against these as well.
Okay.
And what I'll do is grab some screenshots of the Carers app. So as we're starting to allocate the staff to appointments, if they have access to the app, they can see their roster through here. And the CarePlanner mobile app, it works on both Apple and Android devices, and it also works in an offline mode as well. So if they ever run out of data or they have poor signal, they'll still be able to utilize the app. And the first thing they'll have to do is type in their PIN or their password, and then they'll be greeted with a list view of appointments for today.
Yeah.
If they wanted to change the date range, they'd need to use the arrows along the top. And if they want to click into the appointment they've arrived at, they would just tap it on the screen. And once we've done that, it takes us over to the summary tab. And that's got a breakdown of the client's information. However, the categories of information that display on the screen, as well as the amount of days worth of roster that displays on the app, can both be controlled by yourself as an administrator. So for example, I could limit this to just being the next 3 days only, and then the carers couldn't see past the next 3 days worth of roster.
Okay.
And with the categories of information, there's a few examples showing on here. Got contact details, address, call monitoring method, a key safe number, entry notes, and when the appointment was last updated by an administrator. But I might also see on this screen things like tasks, medication, birthday information, appointment notes. All of that could be shown on here as well.
Okay.
And if we wanted to get the carer to clock in and out of the appointment, they could press the start appointment button embedded within the app. And that can be used completely on its own. So when they press that button, it takes a GPS snapshot of where they are on the map, as well as picking up the timestamp that they're pressing that button. And then throughout the visit, and when they clock out, CarePlanner will give prompts to say, have you completed the tasks? Have you submitted your outcomes for medication? And are you leaving a handover note?
Okay.
And with the handover notes, when they're submitting them, they'll be able to alert the supervisor if they want to draw your attention to it. And they can send photos against handover notes as well if it's relevant. And when they're submitting their notes, they actually get stored on the notebook tab at the top here. So when we were looking at the summary of the client's information, if we wanted to go in and see handover notes from the previous carers, we would just tap onto that notebook tab. Under info is where you'd see the care plan document if we'd given the carers access to it via the app. And then under contacts is where we'd see the client's contacts. So again, people like next of kins or key holders, if you wanted to give them access to their contact details.
Okay.
Any questions so far?
Not yet.
Okay.
Not yet.
All right. Well, in terms of the clocking in and out of the appointments, I've covered off pressing the start stop appointment button, but there are a few other methods you can choose from as well. You don't have to go for any of these. They're optional extras, but some companies prefer them. And it's where you'd have a physical device that's stored within the client's home that the carer then has to interact with. And that could be just using the client's landline or their mobile as a method of call monitoring, or it could be purchasing an OTP device or an NFC tag from CarePlanner and populating that into the client's home.
Okay.
The NFC tags, those work on the same technology as contactless. So it's this little plastic disc here, and the carer would hover their phone over the tag with the CarePlanner app open, and that's going to clock them in, and they do the same to clock out later. And with the OTP device, that is similar to what you might use with like online banking or sites that require like a dual layer security for logging in. The carer would press the button on the left-hand side and it will generate this unique 6-digit code. And they can then type that 6-digit code straight in onto the CarePlanner mobile app, or they could send it to your CarePlanner system as a text message. Or in a worst case scenario, if they didn't have access to their phone for any reason, like maybe they've lost it or they've accidentally run it over, they can write the code down, they can keep it safe, pass it on to you later on in the day, and you'll still be able to link that up in your system to see what time they've clocked in and what time they've clocked out using those 2 codes.
So the OTP, it will be sorry, I'm trying to, I don't know how I can ask this question. So
No, that's all right.
Yeah, the OTP is linked to the app.
Yes. So both the OTP device and the NFC tag can interact with the app. So you'd still see where they are on the map, as well as knowing that this device is stored in the client's home. So the carer's having to go in to interact with it.
Okay, so they can't just, for example, just if they are not there and then just send you any 6-digit code or something.
Exactly that. There's a section within CarePlanner in the settings screen that has like an OTP verification method, which will stop the carers from making up a code, because CarePlanner will recognize that that code isn't one that the OTP device has generated.
Okay.
Did you have any other questions so far?
So those ones are £5 per device. That's
Yes,
a one-off.
It is indeed. Yeah. So it's £5 each for the OTPs, or £1.50 each for the NFC tags. And the call monitoring with CarePlanner does have a monthly charge, which stays the same no matter which method you opt for. So whether you were using the app on its own or whether it was one of the physical devices, call monitoring is charged at £1 per client that you monitor each month. So if we had 10 clients, it'd be £10 per month.
Oh, okay. Yeah, that's fine. No more questions.
All right. If we come back to the system here and I go across to the Manage tab, the first thing it's showing me here is a daily overview of the carer roster. And I will come back to this, but I'm just going to jump into
sorry, one more question. I just thought of something. Yeah. You know, on those devices so when they get to the client, they send you that code, the OTP code, for example. And then when they finish, they have to send you another one, isn't it?
Yes. Yeah.
Okay. All right. Yeah, that's all. That's all I wanted to say.
Oh. No worries.
Okay.
The screen I've come across to on the admin side of CarePlanner here is Manage Call Monitoring. Now, I haven't clocked in or out of any appointments this morning, so I've just gone back to yesterday's date.
Yeah.
And as I scroll down here, I've got a completed example. And this is one that I have done using the mobile app. And I'm just using that start-stop button on its own. So I'm not interacting with a device to do this.
Yeah.
And it's showing me the planned time of the visit. It's showing me the actual times the carer attended, and where on the map they were both times. It's showing me the client and the carer, how many minutes late or early they might have been, whether they were just on time, and how much of the appointment they've stayed for as a percentage. Next to that, we've got the list of tasks. In this case, it's only one, and the carer selected yes, that was completed. And then just next to that, there's a gap, which is usually where we would see medication outcomes, but this client didn't have any medication that was needed on this appointment, so it wasn't showing to the carers through the app for a need to complete it. And they've also submitted some notes, which are over on the right-hand side, so I can get an idea of what's happened at the appointment.
Oh, okay.
So this information, it's coming back from the CarePlanner mobile app live in real time throughout the day. And the same when we're updating appointments on the system here, if we make a change, that's going to update in real time and reflect on the mobile app for carers.
Okay.
And then if we come back to my carer roster screen, it's looking a little bit messy at the moment. I've got lots of unassigned appointments here. It's got today's date highlighted, and then we've got the timeline along the very top of the screen. And then we've got the carer names on the left-hand sides. We've got their mode of transport, their availability, and then all of my unassigned visits. So if I wanted to start allocating those to my carers, I can actually pick them up and drag and drop them to the staff member.
Oh, right, okay.
And then CarePlanner's going to highlight if the carer isn't suitable for the appointment. And I'd say about 90% of the time, my carers aren't suitable. In this case, it's because they don't have the skills required. But what we're going to do is press the override and save button, because based on my preferences, every time I see a warning, CarePlanner gives me the option to have the final say. So I can override and save, or I can go back and I can choose somebody new.
Okay.
We can drag and drop those into place one by one. This time again, it's to do with skills and the fact that the carer disfavors this client. We'll override and save that again to assign the appointment. And then on the left-hand side, this little red -7 has appeared. And that's to do with travel calculations. Between these two appointments here, there's actually no time to travel. This appointment ends when this appointment is due to start. So this is telling me the carer is going to be 7 minutes late to the appointment.
All right.
And then when we've got the number in green, it's telling me the opposite. It's telling me they've got too much time to travel, and actually they're going to be a couple minutes early and probably waiting before that appointment needs to start.
Yeah.
And I've also got a few appointments which are grouped into runs. Those have this dark blue line grouping them together, and I can pick up entire runs and drag and drop them to a carer. And the system will still check the suitability of each of the appointments against that carer. I've got a couple of alerts again for each appointment, and they're all to do with skills. If we override and save, that allocates all of the appointments within that run. And we can still drag and drop to decrease duration and change times of the appointments in here as well. Any questions?
No, I think I understood that well.
Yeah?
Yeah, I
All
got
right,
that.
fab.
Yeah.
The only other bit I'll show you, we'll go back to yesterday. Probably got some unassigned appointments in here as well.
Yeah.
And next to this carer here, just above this appointment, there's a light blue line along the top, and that's linking back to the call monitoring. So this is showing the actual times that the carer attended. So it's giving you that like visual reference in amongst the roster to see when your carers are clocking in and out of the appointments.
Oh, okay.
Right. And again, if we were to refine it by area or branch, we go to my Bridgewater area again, you can see how it condenses it right down. So I'm just looking at the carers and client profiles relevant to this area.
Yeah.
There's also another nice view of the carer roster where you can group by region when you're looking at multiple areas. And then we can kind of scroll down area by area, still seeing everything on the one screen.
Oh, wow. Yeah.
And one of the other tabs I'll show you under Manage will be Diary. So where the carers might be submitting notes, either handover notes or notes just back to us as administrators, this is where we'd be able to find them, one of the areas we can find them. And I've got a couple examples displaying. This is the most recent handover note or appointment note that's been sent back to my CarePlanner system at the top here. I can refine them based on categories and date ranges. I can also add in my own diary entries. I might have information I need to log as an administrator. I'm just filtering back, looking at my accidents over the past couple of years, because what we can also do with these notes is make edits and updates to them. And if we do make any changes, CarePlanner is keeping that audit trail. So with this one here, I've made some changes and it's showing them under revisions. And on the left-hand side, this color coding and this bottom section is showing that a task was created because further action needed to be taken.
Yeah.
There's a few where I've alerted supervisors, and as an administrator, I can make comments against these notes as well, and we can see those pulling through. So if I wanted to continue to make edits to one of these, if we click onto the note, it brings up a nice detailed form like this one here. And this is the main body of text on the right-hand side. So we can override it, we can edit it, and we can add to it. Underneath, you've got your section for comments. You can attach for documents and files. And if we need to create a task or update the existing task, we can do so in the bottom right-hand corner. So really good for just showing the action taken, the kind of readiness to take action against anything that might be pinging through here. And all of this information that's going into CarePlanner, we can then run reports on, which is over in the reporting suite here. But before I delve into this, do you have any questions so far?
No.
All right. Well, we'll do a quick overview of the reporting area.
Yeah.
Now, this is broken down into carer, client, and finance reports. And all of the reports within this section work in a similar way to each other. So perhaps maybe I want to send a client roster out to my clients. And perhaps I'm going to email this to them. I could generate it for everybody all in one go. I could choose the date range I want to create it for, and I can add some additional columns. Maybe I want to highlight the tasks that we've linked, maybe show the photo of the carer if we've uploaded it against their profile.
Yeah.
When I press run report, CarePlanner is going to have a little think and gather all of that information for me. And once it generates, it looks like this. So I've got the client name on the left-hand side, got the days and times of the appointments, the carer that's attending, and the task. And it breaks it down client by client. If we go straight back to the top. As well as being able to email, I could print or export these as PDF or CSV documents. And if I was choosing to email this one, CarePlanner gives me the option to send all of the client rosters in one go, but actually have CarePlanner break it down. So although we're looking at the roster all on one screen, when we press email each client their roster, they'll only receive their own appointments.
Okay.
And if we went back to reports, let's look at maybe stats by carer. What this report will do is show me all of my carer names. At the moment, it's just looking at today, and it's totaling how many appointments this carer has and what the total rostered hours are. Now, if I change the filters and we go and look at last week, and we'll add some additional columns. We'll look at the actual hours the carer has clocked in and out with. We'll add in any minimum or maximum hours they might have requested. And I've got a travel mileage rate set up, so I'll also add in any payable travel miles here as well. And again, when I press run report, CarePlanner has a little think, gathers all of this information for me, and once the report is generated, we can email it, print it, save it, or export it from the CarePlanner system. So we've got all of those grand totals for each of the carers individually, and the grand totals for all of the carers as a collective along the bottom.
Yeah.
And it works in a similar way when we go across to finance. So this is where we can generate our invoices and our timesheets.
Yeah.
And once you've told CarePlanner how to charge your clients and how to pay your carers, generating those invoices and timesheets is really quick and simple. So if we look under invoicing first of all, a couple of tabs underneath, and we're going to go straight into invoicing rates.
Yeah.
Because what this does is shows me the groups that I've created. So again, this is something you name and create yourself for your different client types. So you might have private clients and local authority clients. You might have multiple local authorities, so you can break those down into different groups.
Yeah.
And within each of those, you can then create your different bundle of rates to tell CarePlanner how much you charge and when you're charging it.
Yeah.
And if we look at adding the invoice rate, we would give it a name and a description. We'd choose the group that it belongs to. We'd set if the rate was time-based or fixed cost. And if
Yeah.
it's time-based, we could set an hourly amount that then CarePlanner would pick up pro rata, or we could add thresholds to maybe charge differently based on the lengths of the visits. If I had
yeah.
a half an hour appointment, maybe I don't want to charge exactly half.
Yeah.
Or if it was that fixed cost option, maybe we've got sleep-in appointments and we're going to charge a fixed fee for that. We can input that in a similar way. Just typing it into the text box, and then underneath, telling CarePlanner when to apply that rate.
Okay.
And do we want it to apply every single day of the week? Do we just want it on the weekdays, the weekends, Saturdays, Sundays, or bank holidays? And do we want to apply it to the entire day or just between certain hours? And you can change what appears in here.
Yeah.
And if you charge differently based on the job title of the carer going in, the different types of care you might be providing, or the different areas or branches that you might have, you can link those elements into the invoicing rate as well. And CarePlanner is looking for all of that information then on the appointments to know when that rate needs to be applied. And
Yeah.
it'll pick it up automatically. So we'd run through that process a couple of times until all of the invoicing groups and rates were on the system. And when it comes to generating the invoices, the process would be as simple as this. So we'd click generate invoices on the left. We'd filter by groups, client status, the date range we want to create for. And we will go for last week.
Yeah.
And I'll leave the issue date set as today. I'm not going to generate for all of my clients. I'm just going to choose a small handful.
Yeah.
And I'm only doing this because I know I've created some of these already. And I'm just
Oh.
trying to kind of cherry pick a few that we might create new invoices for. And when I press generate, if I have created them already and CarePlanner is therefore stopping me from duplicating them, I see these little pause symbols. Whereas when I'm successfully generating a brand new invoice, I get the green play symbol instead.
Yeah.
The pause symbols can also sometimes show if the client just hasn't had any appointments during that time frame.
Oh.
And when we press done, we get this report style breakdown of the invoices. Got my invoicing number on the left, my client names, the invoicing group, start, end, and issue date, total hours, total costs, and the options in the top right-hand corner to get these out of the system. You can email, print, or export.
But
And we can use the show columns drop-down menu here, just as we were doing in reports, to be able to add additional columns onto the screen. I could just add the bottom couple, filter the invoices, and it builds up a more detailed report underneath.
okay.
And if we wanted to view just one of those on their own, we can click into the invoice number. And this is how mine are laid out. But they don't have to look identical to this because, again, you've got some customization options over in the admin area to be able to alter what displays on the invoice.
Yeah. Okay.
And with this one, it's not going directly to the client, it's going to a family member instead. And that's something I've set against her profile that CarePlanner automatically remembers for me.
Okay.
Any questions so far?
So every, say, Abby, all her invoices will also appear on her kind of profiles.
It will indeed, yeah. If we click on invoices on the left, this will show me all the invoices against her profile. It's only looking at a 1 week date range at the moment, but if we increase that, say back to beginning of December, got a few more.
Oh, right, okay. Okay, yeah, that's fine.
And if we go back to finance, just briefly, I'll click into payments. I won't run through it in as much detail because the process is almost identical.
Yeah.
But for creating the timesheets for the staff, we'd initially input how much we pay them and when that applies. And that
Yeah.
is the same process.
All right.
You might also pay for their travel between appointments. And if you do, you can create separate travel rates.
Oh,
And they
okay.
would look like this. So you give it a name, give it a description, and you choose how much you pay per mile, or maybe per minute, or if you pay for their waiting time. And once you've input the payment rate for mileage or travel time, then CarePlanner will automatically calculate that too. So if we look at generating the timesheets, the process is the same. We choose our date range, choose our profiles, and then CarePlanner is going to do the rest of the work for us. And when we successfully generate brand new timesheets, get those little green play symbols.
Yeah.
We get the report style breakdown of those, which again, we can email, print, or export as PDF or CSV documents. And then most companies from this screen, they would export the information as a CSV and then send it across to maybe an accountant or an accounting system.
Okay.
And if we wanted to look at those on their own, my layout is pretty similar to what we had on the invoicing side. And again, from that previous screen, I could add additional columns to increase the information displaying on the report.
Oh,
Any questions at all?
no, I think I've understood that well.
Yeah.
Yeah.
Perfect. Are there any bits of the system that you would like me to go back over, or any features that you think we've not covered off that you thought we would have gone through on the session today?
Oh, I think you have actually. I think we've covered everything because the main piece that I wanted to know about was
Yeah.
the
Yeah.
call monitoring, which you've explained very well, and also the care plans, and also the invoice side, and how you do the rotas and stuff.
Mhm.
So I think you covered pretty much everything. So on the it's like the care plans, you can either send to the carers app, or you can email direct to them, isn't it?
Exactly that.
Oh, okay. Also, is there also a feature? Well, but obviously, if they want, they need to open it, so they'll have to open it and download it if you send it by email, isn't it?
Yeah, so if you send it via email, they would have it embedded in the email document itself. And if you're sending it via the app, the only way they would access it then is directly through the CarePlanner app. So you won't have to worry about it being on their phones or anything like that. It'll only be visible through the app itself.
Okay. But if you do email it, obviously they can download it, and
Yeah,
then so it's safer to use the app, isn't it?
I'd say so, yeah.
Oh, okay. Yeah, I think that's all. Yeah.
All right. I guess the last question from me then is, has anybody talked you through the costings for CarePlanner yet?
No, that was gonna be my next question.
All right. Well, I will cover this off with you as well. And then after the session, I'll send it over on an email. So you've got this document, but I'll also include a breakdown of the pricing within the email itself as well.
Okay.
The way it works, it all comes down to concurrent user licenses. And what those control is how many administrators can access your system at the same time.
Okay.
It doesn't matter how many carers you have, and it
Yeah.
doesn't matter too much how many clients you have. That only matters when we look at the call monitoring aspect. But in terms of the main costs for the system, it's how many administrators need access at the same time. The first user license is the slightly more expensive one. It's charged at £100 per month plus VAT. And that essentially unlocks access to the entire CarePlanner system. So if you only had that first user license, you'd still have access to all of the features, everything I've shown you around today, but only one of your administrators could ever be logged into the system at any one time. So if we needed more than one, say we've got 2 administrators that need access at the same time, then we would need an additional user license, and then that would be charged at £40 per month plus VAT for each additional user license that you might require. And it can be added or deducted at any stage. So if you find that you're going through busier periods or quieter spells, you can increase or decrease those just with a written request, either in an email or in a support ticket.
Okay. So how much notice if you want to say you add another administrator and you want to remove them? How much notice do we have to give? A month or?
No, so you would just let us know and we would get it removed straight away and it would reflect on your next invoice.
Oh, okay.
And then away from the licensing costs, you've got your call monitoring costs, which we spoke about earlier. So £1 per client that you monitor each month. And if you did want a physical device, you pay a one-off cost to purchase them initially as well. The landline option, if you ever needed to use that, it's the same monthly fee, but you also pay a penny for each telephone call that's made.
Can you explain to me the landline call again? I can't remember.
Yeah, absolutely.
Yeah.
So they dial a free phone telephone number from the client's home phone. And once they dial that telephone number, it prompts them for their PIN. So each carer has a unique PIN, which they type in, and then they would do the same when they go to clock out. They dial that free phone telephone number again, they type in a unique PIN, and that will clock them out of the appointment.
Oh, okay, okay.
And it's a penny for each telephone call that gets made. So it doesn't charge the client, it gets added onto your CarePlanner invoice.
Okay.
And there's 2 additional costs detailed on here, both of which are optional. And the top one is sending a text message from your CarePlanner system.
Yeah.
Only your administrators and office staff can do that. And if you wanted to send them, they're 5p per text. And the other one is additional training. So at the start, we actually provide you with some complimentary sessions. We usually do 2 to 3 separate sessions of training, depending on how quickly you pick the system up and the elements you want to get covered on there. But further down the line, you may find that you hire new administrators and maybe they need a bit more support on the system. They need someone to give them guidance on how to use it all. You could book in for an additional training session with us if that were the case, if you didn't want to teach them how to use the CarePlanner system yourself. And then it would be £40 for the session. But if you or any of your colleagues had any questions with using CarePlanner at any stage, there's no need to just book in a training session like that, because you'll have the support team anyway. You'll be able to call them, email them, send them tickets, and it's completely unlimited. So you can call as much as you need, and they'll be on hand, happy to help.
All right, okay. So another question, so we can actually communicate with the carers through the app and...
You can't send them messages through the app, but you can input information onto the appointments themselves so that they can see that embedded within the notes.
Oh, okay. Yeah. Yeah, okay. Yeah, that's fine.
All right. Last couple of bits from me, just to do with like contract terms and stuff. So the contract for CarePlanner, we don't ask you to stay for years on end. We just ask that you stay for an initial period of 90 days. And then after that, it moves on to a 30-day rolling contract. So we want companies to stay using CarePlanner because they love it, not because they're tied into lengthy contracts.
Okay.
And if you did at any stage decide to get started with CarePlanner, there are no setup fees, there's no upfront costs, and your first month with us would be free of charge to aid in the implementation of the system. So hypothetically, if you were to set up today, your billing start date would be set to about the 20th of February. You'd be able to get logged in today and start using the system, but your first invoice would be sent across and the first payment requested the 20th of next month instead.
Okay.
Have you got any questions on anything to do with pricing or contract?
Yeah, I heard the question. I don't remember now.
Did I make you forget?
So yeah, so it's okay, 30 days. So initially it's 90 days.
Yeah.
Oh, yeah, I wanted to find, so say after the 90 days and
Yeah.
I decide to use,
Mhm.
okay, say for example, I don't want to you carry on with CarePlanner, for example. Is
Mhm.
it easy to migrate data from information from there to another system? I don't know.
It is indeed. So if at any stage you did decide to leave CarePlanner and you were going across to a different system, you have
Yeah,
got that reporting suite, and we'd be able
yeah,
to give you guidance and assistance with this, but you'd be able to export any of your information to do with like your carer client profiles and your finance information from this section. You can export it into a CSV document, which should then be easy to import onto other systems if they're able to do it, or you can save PDF documents and upload physical documents if the other system had the capability of doing that.
okay. And one last question. You know,
Mhm.
like in care, there are so many policies that the carers have to read and
Yeah.
sign that they understand them. Is there a
Mhm.
feature whereby you can upload them there, you send them either via email or via, I don't know, and then when they read, they've read and signed, you can get a report back to say that they've read it?
There isn't anywhere in CarePlanner that's kind of dedicated for that, but other companies have asked me this in the past, and I've got a little bit of a workaround for it. So
Oh,
my
okay.
suggestion is that you build a dummy carer profile. I've got one on here called Office Profile.
Yeah,
And what I can do is upload all of my policy and procedure documents against this profile. And
yeah,
then from the screen, I could email it. I can choose all of the documents that are displaying here, and I can send it to specific carers or everybody. And when we
okay,
send it from CarePlanner, it will keep an audit trail of the fact we've sent that. So if we go
okay.
into, oh, not that one. If I go into
Uh,
emails,
yes,
it'll show me all of the emails I've sent, and it
yeah,
shows you the status of them as well.
yeah.
So I think that'd be the best way of managing that.
Okay, so when it's a kind of opened, they've
Mhm.
sent the email.
Exactly that.
All right, okay. Okay, yeah, that was my last question.
Yep. All right. Well, from here, like I say, I'll pop all of this over on an email for you. I'll attach the document. It'll have all my contact details on as well. And if you've got any questions after the session today, you can send me an email back, or you can give us a call just on this main office line. And I'll be here happy to help if you need anything further from us.
Okay, thank you. Can I take your name? I can remember.
Yeah, absolutely. My name is Ellie.
Ellie, all right, okay.
Yes.
All right, okay, that's fine. Yeah, if you send me all the information through to me, then I will review everything and get back to you.
Perfect. All right. And we'll catch up again maybe at some point next week and just see
Yeah,
your thoughts and if you've got any further questions.
all right, yeah, we will do.
All right, fab. I'll leave you
Okay,
to it. Have a lovely rest of your day.
you too. Thank you so much for your time.
No worries at all. Thank you for your time as well. It's a pleasure showing
Uh,
you around.
thank you.
Bye bye.
Bye.